Good afternoon. This is Ed Crow. I'm going to get us started today. A couple quick things. We do record our webinars, so if you want to watch a future webinar, you'll need to register for our webinars. We usually do them on Wednesdays and Thursdays at 1 o'clock. If there's one you like that you want to attend but you can't make the time, just simply register and you'll get the recording. So everybody that registers gets the recording, including the people who are on today. So we will send that out. If you have any questions along the way, I would just send them into the webinar and I will answer them for you at the end. So I think we'll get started at this point. Today we're going to talk about agent and agency contracting. We're going to go over a couple topics specific to agents and specific to agencies. These are questions that come up often and we get them a lot, so I thought we'd do a webinar on it just to maybe answer some of those questions and address some things you just wouldn't know unless you did it every day and kind of went through the contracting process. So as you can see, there's a number of topics, and I think we'll get right into it here. What I'd like to do before we start is just talk about the programs that Crow and Associates offers. We have our free Medicare lead and marketing program, so that's good for $500 per agent per month. It can be for anything that generates Medicare sales, whether it be leads, marketing, advertising, billboards. If it generates Medicare sales, or that's the intent of it, then it's eligible for the program. You can submit paid receipts to us, and we reimburse up to $500 per agent per month for that program. It's a standard program we have. Our most popular programs are T65 Medicare Seminar Program. We have a vendor that does all the work. They put the people in the seats. You just have to find the venue. They register everybody, gather all their information, which you then have access to. And we're averaging about 70 prospects per seminar. We can do the seminars year-round, and we can do them in every state. We have agents that run them, a number of agents that run them every month, and we get great results. We're averaging about 70 prospects and averaging well over 20 sales over the course of time from the seminar. For those who need websites, we do free agent websites. We have a graphics department. If you get a URL, which you can get a web URL for about $20 for 2 years. We can design a website for you. You do need a logo. If you don't have one, we can also help you design a logo. Connector, Sunfire, and Medicare Bot are the three national platforms for quoting, comparing, and enrolling people into Medicare Advantage, Supplement, and Part D plans. We offer all three to agents at no cost, and all three will be compliant with the CMS call recording requirement rules for 2023 AEP. We have a full quote and comparison site that all agents can access at no cost. It'll quote and compare all insurance products, including hospital indemnity, dental, final expense, term, UL, long-term care, annuities. It's the Annuity Rate Watch quote engine. For final expense, it's FEX, and it's all on one platform. Crow and Associates was built on SEO, Google search. In fact, SEO using long-tailed keyword blogs to win on Google search. I like that topic a lot. I'm happy to sit down with agents or agencies that want to better their SEO search results, and I can show you how to do it at no cost, like we did. So we do those sessions often. And then lastly is carrier marketing money. Carriers do make marketing money available. They give it to us for us to give to agents to help offset their marketing and advertising costs. And that's something you can talk to us about if you work with us, about pre-AEP or during SEP. Helping you access money that we have that is slated for you as agents to write business and offset your costs to do so. All right, so on to our topic, contracting. So we use, and a number of organizations do, we use online contracting. So we send one link to an agent or agency for them to complete. It gets all their basic information, and then they check off the carriers that they want to be contracted with. So fill it out one time, check off the carriers you want, and you can have access and get contracted with multiple carriers from one contracting link. We can email you the link if you want to get set up. I put the URL here. It's long. If we send it to you, it'll just be a link you click on. If the company you want isn't there, most likely we have it. You can just fill it in the remarks section. If we don't carry that company, we will certainly let you know, but odds are we do. If you don't know what carriers you want, maybe you're new to Medicare sales, maybe you're new to insurance sales altogether, simply call us and we can review with you the carriers that are most competitive in the state you're looking at for the type of business you're looking to, type of line of business you're looking to get contracted with. With contracting, it's gotten complicated these days. Oftentimes, agents call in looking for updates. You can certainly call us. Our number is listed there. You can talk to Lisa. She's dedicated to helping agents with status updates, with contracting guidance. So you can call or email her for updates on where you stand with contracts, with certifications, or if you have any additional carriers down the road you want to add. Once you fill in our contracting link, pick the carriers you want, but then down the road, if you want additional ones, you just simply send us an email asking us to add that carrier for you, and we'll do so. I talked over my slide, but you can add additional companies. Again, just email us. We used to do it by phone call, but now we need it in writing, so send us an email. You don't need to fill out an additional contracting link. We can simply add it because we already have your information. Agency contracting. So maybe you're an agent with sub-agents. We work with a number of agencies. In fact, that's one of our goals and our prime themes is to help them grow. So if you're an agency and you want to get set up, keep in mind an agency is if you're having an entity be paid, that entity needs to be licensed and it needs a principal. It needs a person attached to it, especially in Medicare. You can't have an agency getting paid without a person attached to it. So the principal on our contracting, you check off agency and you'd fill out the agency, the entity information, and the principal, the person, would fill out their information. It's pretty self-explanatory when you go on there, but I just wanted to explain it. If you're an agency and you have sub-agents, you'd fill out the principal and agency contracting first. Once that's completed, then we can add the sub-agents. So if you're getting your agency set up and you want to have your sub-agents fill their contracting out as well, just send them the link. Everybody can use the same link. Agents would fill out the link on their own. And then once your agency is set up, then we can slide those agents underneath you for the given carriers. We can't do it, however, until the agency is done. So we get a lot of calls saying, hey, I gave you guys 6 subs that go underneath me. Their contracting hasn't started yet. And the answer always is, well, it's because the agency is not done. And until it's done, we can't process the sub-agents. In this whole thing, communication really is the key. So if you're an agency and you have 8 subs that you're going to have underneath you, maybe you're an MGA and you've got a GA under you and subs under them, it's all about communication. So having them fill out the link and letting our office know where they go. Do they, if you have a sub-agency, which agents go under the sub-agent versus direct to you? It's just about communicating. And when you set up these sub-agents, are they going to be paid direct by the carrier and you're just collecting the override? Or are they going to be LOA, so all their commission and overrides are paying to the entity or to you as the GA? Just got to make us aware so we set it up correctly for you from the beginning. And remember, principal of an agency must be appointed for Advantage in Part D. So in other words, if you have an agency, the principal has to be contracted, appointed, and certified with any carrier you're going to collect overrides on or have agents write. This can be a problem sometimes where you have a principal who doesn't really write business anymore. They're the owner of the agency. They list themselves as the principal, and they really don't want to do certs. They have to do them. Their certs must be completed in order for their agency to receive overrides. In situations where they absolutely just don't want to do them, this is really only for contracting purposes. I'd recommend listing somebody as the principal who is going to do their certifications. The agency must be licensed. So in the insurance business, an agency that's receiving compensation must be licensed in the states it's going to receive the comp in. And an agency must be licensed in the states they have subs in. So if you have an agency and you get it's licensed in Connecticut, but you get an agent in Florida who wants to write, for that agent to get contracted with a carrier in Florida, your agency also has to be licensed in Florida and contracted with that company. People often ask me, does it make sense to have an agency? Well, it depends. You can be a GA, MGA, or SGA as an individual. You don't need an entity in most cases to do that. However, it is nice to have an entity so you can separate compensation, have it all paid to the entity, and be separate from you. The one negative about this is it doubles all your fees up. So when you have non-resident licenses, you're going to pay licensing fees in every non-resident state you're in. If you have an agency, an entity that's licensed, you're going to have two: the licensing fee for yourself in every given state, and the licensing fee for the agency in every state. So you'll double up on your licensing fees. Same thing with appointment fees. Some carriers charge non-resident appointment fees. In that case, you'll pay as the principal and you'll pay for the agency as well. So that is the negative, is it can double up your fees. Okay, so the way our contracting works is you fill it out. We then take that and you let us know the carriers you want. We then take that base information and send it out to each carrier for you to be appointed. In turn, those carriers are then going to send you, for each carrier, an email saying, we've received your contracting information. Click here to confirm you want a contract. So if you're appointing with 12 carriers, you're going to get 12 separate emails. Those emails often go to spam. They're not all going out at the same time. The carriers send them out when they can get to it. And you have a lot of emails flying around, some of which may go to your spam. And what can happen sometimes is if you're not tracking this, we can help you track it, but you should track it on your end. If you're not tracking this, you might miss 3 or 4 of those emails, and then lo and behold, you never get appointed with that company. This can be a really big issue for agencies. So if you think about an agency with, say, 10 sub-producers, those sub-producers are going to get set up with 8 companies each. Well, suddenly you've got 80 emails that are going to 10 different people. They might get lost in spam. They might never complete them. It can be messy. So I strongly recommend for an agent or agency to track the carriers that you are appointing with or that your sub-agents are getting appointed with. If some of them, and you got to follow up with them, if some of them didn't get their emails, they maybe went to spam, or maybe they just didn't get it, and you can call our office and we'll have the carrier resend it. And it's one email for each carrier, for each agent. Same thing goes with certifications. So obviously with Advantage and Part D, you have company certs. You have to take AHIP, but you also have company certs. And the carriers will email you out notices saying, okay, time to do your certifications. Well, if that email from the carrier goes to your spam, you'll never see it. So you got to be on the lookout for them. And remember, you have to take AHIP. So all the Advantage and Part D companies require AHIP with the exception of United. You actually can write United Healthcare's Advantage and Part D simply with doing their certification. They don't require AHIP, but all the other companies do. If you want to take AHIP for the discount of $125, you can. If you take it through the AHIP site itself, it's $175. Most of the carriers offer the discount of $125. We have our own separate AHIP link with the discount included in it, not attached to a carrier. So if you want to take AHIP through the AHIP site, you can do so with us for $125 because we've got a promotional link for that. Non-resident license and appointment fees. This is a big one. So some companies will charge you an appointment fee for every non-resident state you get appointed in. Not all of them do, but some will. The amount of the fee depends on the state. But to give you an example of this, let's say somebody calls us and says, I'm licensed in 40 states. Give me United Healthcare in all 40. Well, United charges non-resident appointment fees. So if we appoint them in all 40 states, that person's going to have 39 different non-resident appointment fees passed on to them from United Healthcare. We have a grid that shows us which companies do and don't charge them and how much they cost. Before you add a bunch of states, you might want to call us and talk to us, because those costs can actually add up on the non-resident appointment fees. So just to rehash, your first step is to fill out the contracting link. If you have sub-agents, you have them fill out one as well. To start the contracting process, we're going to have your insurance license and your E&O certificate. So if you fill out the contracting link, give us your insurance licenses for the states you want and your E&O, we can get you going. If you don't have E&O, we offer it. The way our E&O works is if you get a claim for a product that we are the upline on, there will be no deductible, which is really nice. If it's an outside product, meaning a product that you have with a different upline, that's fine. It's still covered, but then it's a standard, pretty much industry standard deductible of $1,500. Our pricing is very strong on our E&O. We have E&O that covers all lines of business, and it covers, again, zero deductible in-house, $1,500 for outside products through other uplines. And that's $454 a year. I think the pricing is very strong. You can certainly get E&O anywhere you want, but if ours is cheaper, you can have access to ours. We have another E&O for agents that only write Medicare products and final expense. That's $301 a year. So we have very good E&O pricing, and you can call us or email us if you want to talk about it further. Okay, so once your contracting is done, you're going to take AHIP, assuming you're writing carriers other than United. If you're just going to write United, then you don't need AHIP. But you take AHIP, and then you're in the AHIP site. When you're done with it, there's an option to transmit your results to all the carriers that you're contracted with. That's how they know you've completed AHIP. There are a few carriers that don't subscribe to AHIP, and they will want you to physically send by email your certificate to them. That's why I recommend on here that you keep your AHIP certificate once you're done with it. You might need it for some of the smaller carriers. Once AHIP's completed, you've transmitted it, then you can start doing your certifications for each company. And remember, MA and PDP companies all require, in addition to AHIP, their own certs. Strangely, United Healthcare is the only company that doesn't require AHIP. You can just take their certs and sell United Advantage and Part D products. However, they're the only company that requires a MedSup cert. MedSups don't require certifications. Once you contract with them, you're ready to go, because MedSups are not a CMS product except for United. You have to do the United Healthcare cert in order to access and sell AARP Medicare supplement plans. This one sounds really kind of stupid and simple, but I cannot tell you how many times we get calls from people saying, hey, I appointed with a bunch of companies, I can't remember what ones, can you tell me? Or, I know I appointed with a bunch of companies, I'm not sure if I actually did contracting links for all of them. Track your companies you're contracting with. If you're going to contract with 20 companies, make a list. Keep track of them. That way when you call us, we can look it up, but it's easier if you know who you sent contracting in for. We can give you a status update. Same thing with your certs. Keep track of your certs. What company certs have you done? What ones do you still need to do? If you need to sell additional carriers down the road, maybe you want to add a new company you weren't aware of, you simply email us and we'll add it. But what I'd recommend, and you don't have to do this, but I would keep it to contracting. I keep it to the companies you think you'll sell initially. The competitive ones, the ones that you want to sell. A lot of times we'll get contracts that people are asking for 30 companies, half of which they've never heard of, nor do they know if they can sell them. It can be a huge waste of time, because from a contracting standpoint, from a certification standpoint, what I would suggest is add the companies you want, and then if you want any additional ones, you can request them anytime down the road. But no need to add them all at once, especially if there's companies you haven't heard of. So again, for agency, if you're an agency, when you fill out our contracting, instead of doing individual, you'll do agency. Fill out the agency contracting tab. You got to have a principal assigned. That principal must be certified with each carrier. Have sub-agents fill out their own contracting link. And remember, we can't process those subs until the agency's done. So the agency must be ready to sell in any state a sub wants to sell in. So got an agent that wants to write Medicare Advantage in North Dakota, your agency's got to be appointed and certified with that company in North Dakota for us to add them for you. Big one we get a lot is having subs at your same level. So in the agency world, you have street, then you have GA, MGA, SGA. So often we'll get a GA agency that gets an agent who wants to be a GA and recruit themselves as well. Well, you can't move them to GA until we move you up. You can't both be a GA because they can't be underneath you at the same level. So when that happens, we'll check to see if you've got enough agents to move you to MGA. If we do, we'll move you to MGA. We'll move that agent up to GA underneath you. So we got today, it was a short seminar. I usually try to keep them pretty short. This one was fairly short. I appreciate you joining us. Remember, we'll send a recording of the webinar. We'll email it out to everybody that registered. We will have a webinar tomorrow, and the webinar tomorrow is going to be on retail locations and kiosks for Medicare. We're going to talk about how you access them, how you see what ones are available, and best practices for using them. We have a lot of agents and agencies that do very well for years now at retail locations, including kiosks. We're going to tell you what their best practices are, suggestions that will help everybody, and give you ideas of maybe some retail locations in places that have kiosks you never thought of, and again, how you access them. So we'll talk about that tomorrow. Other than that, I appreciate you joining me today, and we'll be on our webinar tomorrow. And if you have any questions, please give us a call, 203-796-5403, and we look really forward to talking to you. Thanks, and have a great day.